Hello, my name is Aurora and I am a cancer survivor. And this channel is all about how to get through the cancer and healing journey with as much comfort and ease as possible so you can focus on the things that are most important to you, like your loved ones and the duty of your life. Today, I want to share with you some ways that I have found to deal with the post-surgical challenges of compression garments and showering and performing personal hygiene with limited mobility in those garments. If you haven't seen some of the previous videos that I've done, I recommend watching them to get tips on how to set up your space to better prepare for post-surgical healing time at home and wound care and things like that. Some of those tips will come into play today when I talk about dealing with compression garments, mobility, and personal hygiene. And a lot of the tips I'm giving may apply to people who have not had cancer, but just have had a major surgery and have to deal with the uncomfortable situation of needing compression garments post-surgery. So I have had 8 major surgeries and no longer have 3 of my original internal organs. So I spent an inordinate amount of time wearing post-surgical compression garments, more than I ever want to wear again ever in any lifetime. In fact, so I have a few tips on how to select them, what to avoid, and how to manage the complexity of going to the bathroom while wearing them if you are the lucky owner of female anatomy, and some tricks on donning them more easily. And someone the other day, I was talking about this, and they're like, what does that mean, donning? So donning is putting them on, doffing them is to take them off. So donning the garments, you'll hear the medical staff say that to you when they talk about putting them on. So let's start with selecting the garments. I will talk about breast cancer surgery because that is one of the things that I've had to have the most surgery for. So I'll talk about that a little bit, but these tips will go really for anybody that's had to have any kind of upper body surgery and is wearing any compression garments on their upper body, but specifically if you've had breast cancer surgery. You will usually go home with ACE bandages, but not compression garments for a lumpectomy. Usually, everybody's different. With a mastectomy, where they are removing a breast or both breasts, you may be asked to wear a post-surgical bra or a compression bra at first. And if you choose to reconstruct with implants at the time of mastectomy, then you will likely also be sent home in a post-surgical bra. And these post-surgical bras were always really comfortable for me, and I didn't have any trouble wearing them. They give them to you at the hospital. You don't have to order them or buy them. In fact, at the end, you'll have so many of them, you're like, oh, what am I going to do with all these things? But if you choose to reconstruct with autologous tissue, meaning with your own muscles transplanted from other places on your body to rebuild the breast, then things get a little more complicated. And I might at one point do a video on how I came to some of the decisions I came to with cancer, because mine is a little bit more complicated than just breast cancer, but how I came to the decisions that I came to, and what goes through other people's minds when they make these decisions, people that I've talked to. But while I might do that in another post at some point, this is not the place to judge people's decisions, like whether they chose implants or autologous tissue or nothing. Some people just don't want to reconstruct. They're like, you know what, I'm good. I'm happy with what it is. I don't care. So that your choices are choices. We're not here to judge. So whatever is going on, I don't want to deal with that or jump into that or hurt anyone over those comments on those choices. Rather, I want to share some tips to help you pick out the right compression garments and how to manage them when they irritate your skin or when you need to go to the bathroom. So I have 3 types of compression garments that I'm going to show you. The first is a full body compression garment, and it is from Veronique. Now, I will say up front that this did not work for me at all. But this brand is a very reputable brand and was recommended to me by a certain one of my surgeons. So it is a good brand, but this particular garment was not good for me, and I'll let you know why. So when you have tissue drawn from multiple body sites, you'll need a garment that can cover most, if not all, of those sites. Because I didn't have very much tissue in my abdomen, I needed to have muscles and veins taken from my thighs and fatty tissue taken from many places all over my body in order to try to rebuild my chest. That meant I needed a garment to cover everything. So after some research, I went with this garment from Veronique. And here is what I found out in this process. When you order the garment, whether it's this brand or another brand, but with this brand specifically, you will need to measure yourself very carefully according to directions, because once you put it on, you can't return it for sanitary reasons, obviously. People are having surgery, there's all kind of stuff leaking out everywhere, then you can't return that. So if you measure yourself very carefully, I would do it 2 or 3 times until you're getting a consistent number, and you're on the cusp of a size. For Veronique, I found that ordering a size up is better than ordering a size down. If the garment turns out to be just a hair too loose, you can wear a long sleeve t-shirt or tights under it, and this will also help stop some of the irritation on your skin. But if it's too small and you can't get it closed, then you basically have a useless garment. So for this brand, if you're on the cusp, I recommend ordering the size up. If you have a particular body part that is disproportionately large, so say for instance you were blessed with extra bits to love on your calf. Some people have really big calves and they have to get like wide width boots. Or if you have extra bits to love on your upper arm, then you may be better off purchasing 2 separate garments from this brand in 2 different sizes rather than a full body one, because it is very difficult to find a full body garment that isn't too tight on the larger body part and then still compresses every place else where it's supposed to compress. And most people aren't. In fact, I don't know anybody that's completely proportional. So these full body ones, I recommend approaching with much caution. If I had to do it again, I would not have purchased this. Veronique uses a type of sheer fabric on the sleeves of this particular garment that may not be compatible with sensitive skin. When I donned this garment, after the second night of wearing it, the insides of my elbows were completely raw. It was from the fabric rubbing my skin, and the skin under my arms was chafing as well, and it just hurt so bad. But because I needed really heavy compression on the lower half of my body and my legs, I didn't want to just ditch it because I needed the heavy compression there, and the suit was like $200. So I ended up cutting off the sleeves and just resigning myself to the fact that I would need to buy another upper body compression garment, and I got a different one. So it is also worth noting, depending on what type of surgery you're having. So say you want this compression garment because you're having a surgery where, like maybe on your back or something, but you don't care about your chest, maybe it's not for you a breast surgery, then you're probably fine. But if you are having breast surgery, please note that for me, I could not fully fasten this garment in the front because it put too much pressure on the breast and would have interfered with the newly transplanted tissue establishing its own blood vessel network in its new bodily location. So beware the full body garment. It may be too tricky to use for whatever type of surgery you're getting, So think about those things, about what kind of fabric is it? Is it sensitive on your skin? Can you close it where it needs to be closed? Will it have all the compression in the right places or too much in some places? And it can be tricky. So think carefully before going full body. The next garment I want to show you has been the one I have used the most throughout all my surgeries. It's by Mirena, and it was actually given to me for free by one of my surgeons. Not all hospitals or surgery facilities do that. Some, you have to purchase the garment before the surgery and then come to the hospital with it. But this one was given to me, and I highly recommend it. You can also buy it online. Everything I'm talking about today, I should say, nobody's paying me to say this. These are things that were actually recommended to me by surgeons. I actually used them, and this is my literal review of what these garments are and how they work and some tips for using them. So I'm not being paid to say any of this. And yeah, anyway, you can buy all of this stuff online too. You can order it for yourself. None of it is super special that you have to go through a bunch of hoops to get it. And most of these garments you can pay for on your HSA card if you are in the United States and you happen to be lucky enough to have a health savings account, or you can put pre-tax dollars in there. Everything, I was able to buy everything except for the Veronique. For whatever reason, the HSA would not recommend it. They would not allow the transaction. I guess they thought it was lingerie or something. I'm like, trust me, there is nothing sexy about this. But it wouldn't go through on the card. I don't know. Maybe your HSA will have better luck. Mirena, I have bought other garments from Mirena, and it did go through on the HSA. But this one's great. The compression was just perfect. It wasn't not too much, not too little. The fabric is soft, it's smooth, it doesn't irritate my skin at all. It has highly adjustable closures, so for all the various stages of healing, because as your swelling goes down, because the whole reason for compression garments is to reduce the swelling, so as it goes down, you can hook. It has multiple levels of hook and eyes, so that you can just tighten the garment on the various hook as you heal. And it does not come up over the breast at all. So it will compress your back and your sides and your legs. And depending on where your surgeon needs to draw tissue from for a transplant, or on what kind of surgery you've had, maybe you're not having breast surgery, this garment is, I think, great. It's fantastic for anything except for the arms and lower legs, because obviously it just has the straps. The only drawback to this garment is that sometimes the straps did cut into my shoulders. So I recommend checking out Mirena. The fabric is just much easier on sensitive skin. Now, the next two garments I'm showing you have a firm but light compression, and I absolutely love them. They are from a company called BioFlect. And these are not official post-surgical compression garments. So they may not have the compression strength you need at first, right after surgery. So before you don these, be sure that they will be what you need. I originally got these for lymphedema, which can happen after cancer surgery, and I'll talk about lymphedema and dealing with that in a totally different video, because that's a whole topic all unto itself. But when my swelling from the actual surgery had mostly gone and the bruising had faded and all my other garments were really loose and not really compressing anything anymore, then I like to switch to the BioFlect ones, because they feel so much more comfortable and soft, but they're still helping that longer term like fluid retention go away. And the first garment is the one I use for my arms. And when they were running out of places to harvest tissue from me, they had to take some from my arms. And this looks like a noodle, but really it just fits right over your arms. You just slide your arms in, it goes right across your upper back, and that's all it's for. So it doesn't compress anything else. So that's very convenient depending on what type of surgery you've had. If you're just trying to stop swelling in your arms, perfect thing. And then I have these leggings. And notice that unlike the other two compression garments, these leggings do not have a hole where you can go to the bathroom. So I don't recommend these leggings until much later in the healing process when you're able to comfortably pull them on and off over your incisions. These are more, like I said, for very towards the end of your healing when you still are wanting to keep swelling down, but you're out of your regular compression garments that are officially post-surgical ones. The only caution I have about this BioFlex brand is if you have really sensitive skin, which I do, and these have a micro massage technology that has these little raised wave patterns. When your skin is super sensitive to start with, and then you put it through weeks of compression and surgical trauma, it's going to be even more sensitive. So these little raised, like waffle pattern waves can sometimes be too much. And after a few hours, your skin might start to be irritated and itch a little bit. If that happens, I just turn them wrong side out. Just turn them wrong side out for a couple hours. It doesn't, it still compresses. It doesn't have its, micro massage, but if the micro massage is hurting you, then you don't need it. So, another solution you can do is to wear a very thin, long sleeved t-shirt or very thin leggings underneath the compression garments if it's bothering your skin. So let's go back to the first two garments with the opening to go to the bathroom. So let's talk about this. At first, this may seem very simple. If you're a female, you just sit down and go. If you're a male, you have far fewer issues with it because for obvious anatomical reasons, it all just hangs out there. But for a female, depending on the level of swelling and temporarily altered pee flow after being catheterized, you may find pee gets on the garments. So remember that for many of these surgeries, especially if you're doing like a reconstructive surgery for breast cancer, my longest surgery lasted over 13 hours. Like you're under anesthesia in the operating room for 13 hours. It's a long time to be catheterized. So everything's being cut open. You're swollen, like everything's swollen. It will take a few days for that swelling to go down. And so it's not everything's going to be different. Stuff's not going to come out in the same way that it used to. It'll go away. It gets better. But at first, be prepared that things may get a little messy. So when you don the compression garments with the opening, I recommend trying to arrange that opening as far back on your anatomy as possible because this will make it less likely for any leakage to get on the garment because you're not going to walk around in a pee-covered garment. These things are expensive. How many of them are you going to buy? And you're supposed to be wearing it 24/7 for your first few days out of surgery. You're not supposed to take it off at all. So you even wait 48 hours to shower because you're waiting to keep the swelling down with this garment on. So you do not want pee on this thing. So if you can, arrange that opening to go to the bathroom as far back as possible. When you are seated, then you can also take your fingers and slide them in the opening of the garment so that you're pulling it away from your skin a little bit, and just pull the fabric away from your skin, and then that will also help keep everything dry and away from where the pee comes out. This doesn't last very long, this stage where you're like, oh my gosh, this is such a pain. How am I supposed to even go to the bathroom? It's only really the first 3 days when you are very swollen. Every day it gets a little bit easier. And remember that you will need to wash these garments pretty frequently, especially in the beginning because you're wearing them all the time. And cleanliness and sanitary garments are really important to prevent wound infection. So I use Lysol laundry disinfectant. a hypoallergenic clear laundry soap from Costco. I wash them on cool, not cold, and then dry them on the normal setting or lower. So a couple of things about that. One other tip that I mentioned in a different video, if you are just confounded by the whole pee thing and it's just making a big mess, another thing you can try is I would take saran wrap after my third surgery. I figured this out. Take saran wrap and wrap the plastic wrap around your legs and then go to the bathroom. And then you're covering up the garment with plastic. When you're done, you can just take it off and throw it away, and your garment is dry. So that's another option for trying to keep pee off of those compression garments during those first 3 days when you cannot take them off. And then after that, you can take them off, and I would take them off and wash them while I showered and did my wound cleaning and my dressing changes and all of that. And then by the time I got done with that, they were clean and I could put them back on. So that first stage is only a few days. Now, what I said about cleaning them, where I was listing those products, I know some people might get really upset or concerned about using products like the Lysol laundry disinfectant. I have a whole nother video where I talked about different products that I used and why, if you want to watch that, from like soap to house cleaning stuff, because between my irritated skin and a great sensitivity to scents, to fragrance, which can also happen when you have cancer, I needed to make a lot of changes in what I used around the house. And the reason I settled on this Lysol is because it's extraordinarily effective at cleaning germs. It is not strong scented at all, and my skin has zero reaction to it. And I know some folks are worried that, oh, well, these ingredients contain, or these products might contain ingredients that cause cancer. Didn't you just have cancer? Yes, I did. I do realize that when it comes to having toxins in our cleaning fluids and personal care products and things, that it's the cumulative effect, right? If there's just a tiny bit that doesn't cause cancer in that amount in that product, then that's fine. But if we're using 25 products, all of which have that tiny amount in there, suddenly it's not a tiny amount anymore. I get that. That is true. However, in this situation, the probability that I would get an infection after surgery was far greater than the probability that I would get some new type of cancer from using Lysol laundry disinfectant. And I needed to be really, really careful, especially as a cancer patient. You have a compromised immune system. I wanted to be careful of infection. I don't want to get one. So for me, it was the lesser of two evils to use the Lysol laundry disinfectant. And I love that it works great. So you will have to make whatever choice is best for you and what you think is right for your health and for the planet. But these are just products that I recommend. If you don't like them, feel free to scroll on and not use them. Another good thing about the laundry disinfectant with Lysol too is that it does not stain the white plastic container. Therefore, the container is recyclable. A lot of detergents and things, people don't realize that if the container's stained, you can't recycle it. So there's not a problem there with this. So yeah, that's my tips on how to select a compression garment, how to go to the bathroom with the compression garment, some ways to keep it clean. When you are donning the compression garment, one last tip. In some cases, they will want you to put it on before you leave the hospital, depending on the type of surgery you had. I had one surgery where the nurse who was checking me out, who was discharging me, I guess they're called the discharge nurse, was very eager to help me put the garment on, but wasn't really paying attention and put it on over my underwear. Which means I now couldn't get the underwear off. So when I got home, we had to take scissors and cut the underwear, like pull them out and cut them and like pull them out of the garment because she didn't remember to take my underwear off, don the garment, then put the underwear on over the top of it so that they could easily be removed. So even if you're in a rush to get home and you are done with the hospital and you want to leave, um, please have whoever is there with you on the day of surgery, whoever is driving you home, to be present there to help you get ready and help you get dressed and help remind people, hey, are we really putting this on right? Do we need to take the underwear off first? And to watch as the nurse helps you don the garment for the first time so that whoever is helping you when you go home can help you get it on and off in the beginning. So it's always good to have that person there who hasn't been under general anesthesia and therefore is more has the presence of mind to help you get ready more easily. So one last tip. I will see you in another video where I'll be sharing some more tips on how to take care of yourself and get through the post-surgical journey. So until then, stay healthy and take care.